Good morning, good afternoon, and good evening to everyone. It gives me great pleasure to welcome you all to the second edition of the Professor Rajani Prasanna Endowment Lecture Series on Climate Change. We are honored to have your presence here today. Academicians, researchers, students, practitioners, and passionate individuals who recognize the urgent need to address one of the greatest challenges of our times, climate change. This lecture series stands as a tribute to Professor Rajani Prasanna, whose unwavering commitment to climate awareness, academic excellence, and societal responsibility continues to inspire us. We are profoundly grateful to Professor Rajani Prasanna Madam for the generous endowment and the ongoing support that had made this platform possible. Through this initiative, we aim not only to disseminate knowledge, but to catalyze impactful dialogue and action around climate resilience and sustainability. As we confront the complexities of a changing climate, one of the most powerful tools lies in geospatial technologies. From satellite imagery and remote sensing to GIS-based modeling, geospatial applications are transforming how we understand, monitor, and respond to climate impacts, be it rising sea levels, urban health islands, deforestation, or shifting biodiversity. Today's discussion will undoubtedly enrich our understanding of how spatial science intersects with climate action and how we, as a collective, can harness this synergy for a more resilient future. It's also my pleasure to introduce the moderator for today's lecture, Professor Balakrishna K. from the Department of Civil Engineering, Manipal Institute of Technology, MAHE. Professor Balakrishna sir is respected academician and practitioner with expertise in geospatial technologies and environmental systems, and we are privileged to have him lead the discussion today. Once again, I thank you for being part of this meaningful event. I now hand over the platform to Professor Balakrishna, sir.
Thank you very much, Dr. Rahul, for the introduction of the topic and also briefly introducing me. Now I think the topic chosen is very relevant, especially we can hear across the world the impacts of climate change. Recently, there's a lot of thunderstorm, and in India, just 2 days back in Kashmir also, we had these heavy rainfall and people are getting killed, Uttarakhand and so on. So the climate change, I don't know, the abnormal rains could also be, because of the climate change. We have today, as you have rightly introduced, two distinguished speakers, Dr. Rima and Dr. Sunil, who is our friend. I'll introduce him later. First, I will introduce briefly Dr. Rima. I have a CV here. Very briefly, though, she is traveled across. She started from Lebanon, from the American University of Beirut, with her BS, and then went on to do her MS in the Cyprus Institute of Environment and Public Health. And then she moved to Boston, to the Harvard Chan School of Public Health, where she completed a doctoral study, Doctor of Science. And then she continued for her postdoctor in the same institute, and then current and also a postdoctoral fellow in where she's currently there in the University of Southern California. Currently, she is an associate professor of environment health and spatial sciences at the University of Southern California. Her research aims to understand the effects of complex air pollution mixtures and climate-related exposures on the health of vulnerable populations across the life course. She leads the CLIMA. CLIMA means climate-related exposures, adaptation, and health equity at the center at University of Southern California, and also co-leading the Nexus, which is nothing but a network for exposomics in the US Center, aiming to advance precision environmental health. Professor Rima received her doctoral science from the Harvard Chan School of Public Health. Other than that, I see in her CV that she's there she's a member of several international boards as an expert panel member, and then also she has received several honors, including the Young Investigator Award in recognition of science pursuits and accomplishments, as well as demonstrating potential for future leadership in environmental health science, NIEHS, and science. What is the research? She works extensively, other than what I have told, on air pollution, effects of air pollution, heat stress, wildfire smoke, climate change on health, and so on. And she's also measuring personal exposure to air pollution in the breathing zone as individuals go about their usual day and activity spaces. And she is also, her research has contributed in understanding the effects of multi-pollutant exposures and mixtures, especially particulate matter, PM, PM10, PM 2.5, its components, sources on pediatric and adult asthma exacerbation, inflammation, and health. So yeah, the list goes on. She is well, a reputed scientist. We are really fortunate, Professor Rima, for accepting our invitation. So we are eagerly looking forward to hear the excitements, whatever you have. And then, thank you very much. Dr. Sunil is a professor of geospatial technology and applications and the founding director of the BCC Geospatial Center of the University of New York Crest Institute. His interdisciplinary research in the areas of geospatial, AI, and image analysis of multispectrum Earth observation data will enable researchers to extract spatial, temporal, and semantic geointelligence that are critical for conducting multi-scale scientific investigations for a wide range of applications. He has led NSF and NASA projects for 11 years and currently PI of a NASA project. And briefly touch upon his career. He started from India. So he he did his Bachelor of Arts in Geography and then went on to the Indian Institute of Remote Sensing, a prestigious institute of Indian Space Research Organization. He earned his master's degree there and a postgraduate diploma in human settlement analysis. And then on, his expertise is mostly in developing novel algorithms for urban scene classification, feature extraction, and object detection. He spent a big time for his PhD in Australia, the University of New South Wales, and then he moved to the US in 2008 to the University of New York. And since then, he is in various capacities. He is leading the center. He was awarded the presidential grant for global initiatives to deliver workshops and lectures at IIT Mumbai, Indian Institute of Science, and other places in India. The award led to international research collaborations, resulting in multidisciplinary projects and peer-reviewed publications in Springer Nature. He is widely published scholar and has delivered invited talks, including the keynote address at the WSEAS International Conference for Remote Sensing. He has served on technical committees of the IEEE International Geosciences and delivered invited talks across the world. Sunil was also felicitated by the chair of the CUNY Board of Trustees for his contribution to CUNY on multiple occasions and his contributions in developing geospatial technology at SUNY. And he's recently been to Manipal also including the Prasanna School of Public Health, and he has kind of brought all the institutions of Manipal together on one common theme of geospatial technology. And we have been now working closely with him for a long time to come to develop an independent master's program in geospatial sciences and even a center on geospatial technology and so on. So hopefully he will be serving us as an international faculty also, and we will have more interactions with him.
Thank you so much for having me. Thank you, Dr. Balakrishna, for this wonderful introduction. Thank you, Dr. Kapil, for the invitation and the Prasanna School. And I'm very delighted to be here with Dr. Sunil, who I've had the pleasure of meeting through this. And we're excited to tell you more about climate change, its impact on health, and how we think about evaluating this using very exciting geospatial tools. Thank you so much again, and I will try to keep this very brief so that we have time for the really interesting discussion, but also because Dr. Sunil will be sharing a lot more in the part 2 of this session that we have today. So my work that I will be discussing today is really about how we understand the devastating impacts of climate change on health. If you're all here, I'm sure you know why we care, because it's very clear across the world how much climate change is devastating individuals and communities' health. In our work, we try to think about how complex it is to forecast and predict a lot of what we call climate hazards and the exposures that result from them. And it's very hard because these are very sort of complicated, quickly changing types of hazards that most of the time occur in some sequence of events that's not super independent. We think of climate change as a very global phenomenon, but we know that its effects are highly localized, really impact very specific neighborhoods and communities. So as much as we need the science on a global scale, we also need to do the science on a very micro, local scale. When we think about climate impacts on health, it's not just the hazards and the exposures. We also think heavily about adaptation capacity and vulnerability. And I know Dr. Sunil will also talk about this. And that's because not everyone responds the same way, even if they're exposed to the same thing. And so the reason we do this, of course, is to be able to derive some real-life evidence and data that's very locally relevant to inform policy and solutions. And then I want to end very briefly by telling you about the emerging field of exposomics, which is sort of a new framework that we're applying to a lot of our work to understand the impacts of the environment and multiple other things on health. I'm sure many of you have seen this plot before. Climate change drives health risks. That's because of the hazards themselves. So when you think of a heat wave, a storm, sea level rise, etc., these hazards translate into exposures when people and communities get in touch with them, and that could be in very specific settings like occupational settings. It could be through specific media like your food systems, but they also don't act in that way alone. They have a huge impact on vulnerability, and vulnerability drives their impacts as well. When we say vulnerability, we kind of mean factors that are weak points that drive people to respond differently. And the health outcomes, of course, are very diverse, from cardiovascular to respiratory to mental and psychosocial to, zoonotic or animal type impacts as well. This is a plot from 2024 from just the US showing billion-dollar weather and climate disasters. And this was not updated in 2025, but we're very much on track to exceed this number. The total cost of these disasters was estimated at around 180 billion US dollars in 2024. So this just shows you the scale of these events and the fact that they do not happen independently as single events on their own. Now, I would like to draw this parallel with how we think about impacts of climate change versus how we typically think about health equity and health disparities, because again, the same concepts apply here. When we're doing environmental justice research or environmental health disparities research, we talk about this double jeopardy where certain groups of people could be disproportionately exposed to a lot more pollution than others. But it's not just that, they could also be more vulnerable to its effects. And that's because they experience chronic stress, they live in poverty perhaps, their housing conditions are poor. So it's both the exposure, how much they are getting in terms of pollution, but also their vulnerability. And we expand on that framework a little bit in the climate health space, where we talk again about vulnerability, but also adaptation or the ability to adjust, let's say, and resilience, the ability to recover, to understand these health impacts. So all of these have a role to play. In the environmental justice framework, vulnerability is driven by several things. As I said, it could be that certain people get very high exposures, like you live in a neighborhood that's very industrial, you get a lot of that type of pollution, for example. But there are also social vulnerability factors like poverty and stress and not being able to get reliable health care. And there could be also biological susceptibility factors like, the age. So, for example, babies and children we worry about, elderly individuals might have more underlying conditions, etc. In the climate change space, this framework sort of talks about these three pillars. Again, exposure, sensitivity, or how much you might be impacted, ability to adapt, so how much can you adjust to these hazards. That all feeds into vulnerability to impact health at the end of the day. And of course, we don't want to forget about resilience, so the ability to kind of recover or come back strong from these hazards. So I'm going to give you very brief sort of high-level examples from our work on these topics, starting with the Klima Center that we just established last year at USC. This is an NIH-funded center from the Climate and Health Program at NIH. And we're really focusing on this idea that I explained, which is that the effects of climate change are really driven by exposures and hazards, but also these elements of vulnerability. And so that's why the name of our center is heavily driven by this mission. And we're trying to build transdisciplinary science capacity to advance this kind of work so that we can inform policies. Now, the word transdisciplinary is very important to me and to our mission because climate change and its health impacts is not a single field. We need everyone's expertise to be able to advance this, and not just, let's say, epidemiologists and biostatisticians and medical doctors, but also earth scientists and geospatial scientists and exposure scientists like myself, etc. Very briefly, what we're trying to do in the center is advance models for wildfire smoke and for heat stress, because our focus is California and these are our predominant hazards. But also, so this is work with the brilliant Sam Silva and Jiaqian Zhang and myself, but we're also looking at human adaptation capacity and system-level adaptation capacity. And that's work led by Kelly Sanders, who's an energy expert, looking at power outages and air conditioning rates, and by John Wilson, looking at three-dimensional models of urban tree canopies and how much they impact shade and cooling in a city or in an area. Our focus is cardiovascular health across the life course, and we're trying to also expand that into children's multiple other outcomes for health. So I will skip over some of the details, but please go check out our website. This is our amazing team of investigators. Next, I want to show you some more specific examples from our work as a case study in terms of how we bring all these things together. And so we, of course, you've all heard in January about the Los Angeles wildfires, but in California in general, many other areas of the US, but also the world. So Europe in the last month, from Greece to Spain to Portugal to France, all had massive wildfires. To understand their health impacts, we really need to be able to predict or model the exposures to these wildfires. And specifically, I'm talking about the smoke element of wildfires, because you all know you could be exposed to the disaster itself, or the smoke that travels very long distances and changes in its chemical composition depending on what was burned and how long it's been in the air. But also you could be exposed to ash and kind of debris if you're very close to the fire but not in the middle of it, right? So I will not talk about the technical details too much, because I know we have Dr. Sunil here, and he is an expert in all of these geospatial methods and will tell you a lot more about how we use these technologies and tools. But I'll just show you quick examples of how we leverage spatiotemporal modeling and satellite data, etc., to predict exposure to wildfire smoke for populations. The other complex thing about wildfires, so you see here in the plot on the left, these were some fires burning in Canada. The smoke travels very long distances, and we know this, but it also starts up very high in the atmosphere, and then as it moves or evolves, it starts to mix in the air, reach ground level, and kind of change in terms of its vertical distribution. So that's another element that we rely on remote sensing data to figure out. These are examples from the January wildfires in LA, specifically on January 10, when most of the Palisades and the Eaton fires were very active. And again, you see, if you zoom in, these look like kind of stable plumes, but if you zoom out, you can see how complex the path that a wildfire smoke plume can take and how convoluted. And that all adds a lot of complexity to the tools that we can use to repredict it. So just a couple of examples from my group's work on how we sort of integrate data from low-cost sensor networks, from satellites, from physical and chemical dispersion models into machine learning frameworks, or deep learning frameworks actually, to repredict wildfire smoke-related PM2.5 and PM2.5 as a whole. So I will not go through the details, but all these papers are cited for you here. But we've built these types of models on an hourly level for Los Angeles, with the example you see on the left, and on a weekly level for over, I think, 15 years or so for California. And again, the complexity can vary a lot, but most of these integrate very diverse sources of data and geospatial technologies. So what do you get from these kinds of models? You get these prediction surfaces for data that is very highly spatially and temporally resolved that we can link into our health studies. So from our hourly model, you can see that we can repredict, let's say, what I'm referring to as random, but really a typical weekday or a weekend in Los Angeles, the different hours of the day, and what PM2.5 levels were that day. This was work from Yugang Liu, who is an excellent scientist now at Stanford. And back then when we were doing this, the Woolsey wildfire was a big concern. And we could also see that we were able to repredict its impact on air quality very nicely throughout the day. And you can also see how sensitive the smoke is to wind direction as well. And this is in parallel what we call Independence Day or 4th of July in the US, where at the end of the day, you see a lot of fireworks and the air quality deteriorates very quickly. The real-life image of what this fire was emitting looks like this. So again, you see it's a very complex plume. Many times with wildfires, the ground level air quality might be fine, but the smoke is aloft, and it takes time for that to sort of reach ground level. Moving on in this case study to showing you how we think about impacts of wildfires on health outcomes, Roxana Khalili here is my postdoc, and she's done this great study in our pregnancy cohort, which is part of the Madre Center that's led by Carrie Breton and Tracy Bastain at USC. Roxana looked at critical windows of exposure through a pregnancy because we know it's a very vulnerable time for the mother and for the baby, even earlier than that in the preconception period. And she looked at whether wildfire smoke exposure and heat stress exposure have an impact on the baby's birth outcomes. So how well or how quickly they're growing according to where they should be. She also looked at whether living in a climate vulnerable neighborhood changes that risk. And this is all based in the sort of the urban heart of LA, just for context, so you can see on the map here. This work just got published, so please check out the paper. But Roxana saw that the risk of being born small for gestational age, or the odds ratio really, was elevated in the preconception and the first trimester period for both heat stress and for wildfire smoke exposure. But very interestingly, the effect was almost double if the woman happened to live in a climate vulnerable neighborhood. So it's not just that there were independent risks for being exposed to high heat stress and to high wildfire smoke, but also these effects were almost twice as high, especially for the heat stress element, if you lived in a climate vulnerable neighborhood. And that's direct evidence of how vulnerability has a huge role to play, and we really need to understand it. I will skip over these details, but but there are many ways or methods that we use to assess these exposures. It's not just one metric that we rely on, because they all have different sort of strengths and weaknesses. But to explain a little bit how we do this, we assemble what's called a residential timeline for each participant in our study. So we figure out where each woman lived at a certain day in her pregnancy. So these are these timelines for all the individuals in our study, and this red period is when these women were pregnant. And just to show you that if we overlay this with when there was a wildfire that was active in Southern California, you can pretty much see that for most of these pregnancies, there was some sort of wildfire taking place. And it could be one, or it could be many wildfires, and it could be small, or it could be very large areas that are burning. So we saw that on average, women experienced 130 days of active wildfires when they were pregnant in Southern California in this study. And the maximum could go up to 211 days, which is almost 7 months out of a 9 months pregnancy, again, in Southern California. So these events are not at all rare. And if you think of a typical pregnancy, that's a significant amount of time. To give you more details on how we think about climate vulnerability and how we assess that, we use the Climate Vulnerability Index that was developed by T. Lewis et al. This is a great paper that I highly recommend. They did exceptional work combining what I was describing as baseline vulnerabilities and climate change risks into one score for each census tract of the US. And there's a lot more detail in these elements, and I know Dr. Sunil will also talk about them, so I will not go into detail here. But again, it's this idea that it's not just the hazards and the exposures, it's also the vulnerability, and we have to look at them together. And so that's the data we use that Jan, my postdoc, sort of brought into the analysis. And just for interest for our audience today, I did spend some time trying to find a similar data product for India. I'm sure there are newer things out there these days, but I found this very interesting climate vulnerability index for India at the district level. Now, it only focused on the particular hazards that are most relevant for India, so that makes sense. But you can see also they score the different districts. So I wanted to show you guys some data. I looked up Manipal And hopefully I got the region correct, but you can see that by combining data and all these hazards together, you could get a sort of objective assessment of vulnerability to climate change. And so, for example, around Manipal, certain districts could have very low vulnerability that's driven by drought versus right to the north, for example, or around, there's more risks of flooding, droughts, and cyclones. And you can very much see where the areas, if I go back one, the areas that are most vulnerable to climate change in India are ranked very clearly here. So this is not only useful for research studies, but also to inform policy, of course. And of course, you can get into a lot more detail with how these indices are built. Now, very briefly, I want to also talk about how we sort of assess these things on a more personal level, because of course, when we build these large models, they're extremely valuable to understand population level exposures and risks. But we as individuals breathe air pollution right around here, right? And the gold standard, at least in the kind of environmental world, is personal monitoring when it's feasible. Now, it's very hard to do these studies. I am not trying to imply that we can do them in thousands and thousands of people yet, but I do want to show you how the level of resolution and information we can get from these types of studies could be very sort of personalized and individualized and helpful to understand environmental risks in general, but also climate-related exposures and health risks. So in the pregnancy cohort that I was talking about earlier, my team and I ran several different personal monitoring studies, and that's where we deploy these wearable sensors and small sort of samplers for air pollution, typically in a handbag or a device that someone could wear reasonably in their day-to-day life. A huge element of this is thinking of people's day-to-day lives and making sure whatever you design is actually going to be used by your participant and not too burdensome. The nice thing is that we pair these samplers with very detailed GPS measurements, so we know where people are at different times. The very brief example that I'll show you from this work as results, and this is the work of Dr. Yixi Liu, who is now an assistant professor at the University of Kentucky, is that by comparing what these pregnant women were breathing, and this was in the 3rd trimester of pregnancy, with what we were measuring outdoors on these stations and monitoring sites that we have. So on the left, you see that personal exposure measure, and on the right, you have what we call the ambient air quality. And the different colors are sort of the quartiles, classifications. Think of these as low to high exposure. So if I was using the personal measurement device, this many people would be classified into a very high exposure. Versus if I was relying on outdoor data, a lot more people would be classified as very high exposure. And this was true. So the comparison is when there were big wildfires burning versus when there were not. When there are no wildfires, these red bars are way more similar to each other, meaning there's very little exposure misclassification or error. Versus when there were wildfires burning, that difference is much larger. That tells us that people change their behaviors when a wildfire is burning, and they try to avoid that smoke exposure. But that only happens when the wildfire density or intensity gets to be very high, meaning most of us are probably exposed to low levels of wildfire smoke from some regional transport at some point around us, but it's only when we start to notice or perceive the smoke as high do we start to change our behaviors and take protective measures. And these kinds of levels of sort of detail can only be figured out generally with these much more sort of personalized assessments. Okay, the last thing I want to cover is the emerging field of exposomics, and that's to tell you about some very exciting work we're doing in Nexus, but also to show you how in sort of all the disciplines and work that I do, I see a big shift towards more systems level thinking about how the environment and all its elements affect our health. And we're also starting to use exposomics to understand climate impacts on health. So it's very relevant. I'm also the MPI, or the co-director of the Nexus Network for Exposomics in the US, which is led by Gary Miller, Chirag at Columbia University, Chirag Patel at Harvard University, and myself at USC. What is exposomics? And I'm sure many of you have heard of this concept before, but Dr. Christopher Wilde first defined it in 2012 in this paper as the idea that the exposome, your own exposome, is every exposure you've been subjected to from conception to death. That's a very big concept, right? But it includes things that are in your general external environment. It includes things that are specific to you in your life, that you are exposed to in the external environment before things enter your body. And it also includes your own internal environment, meaning chemicals that you might be exposed to that end up in your body, or chemicals that your body might produce through metabolism, etc. And the reason I mention this is a large element of the general and specific external environment constitutes factors related to climate change. So air pollution, heat stress, exposure to hazards, etc. And even though these domains are not super clearly defined as separate from each other, it's important to think of how they are all intertwined and they all affect our health together. I will skip over the details, but I did want to highlight for you a couple of more recent important papers explaining the exposome and how it affects our health, especially this paper in Science Now that came out of an important conference where people got together to really operationalize and define the exposome. And it's again the idea that it's this integrated compilation of all physical, chemical, biological, and psychosocial influences that impact our biology and health. So you see, again, we don't just think of the exposure, we think of the social environment, things that drive vulnerability together and how they impact our health. Nexus is a very large network. We are a coordinating center. We have a website and a newsletter and social media, and we're always looking to engage more with our colleagues across the world. So please do check us out and learn more. But also within Nexus, I lead the Geospatial Sciences Hub with Dr. Arkat Rajasakar, and we're developing these frameworks and tools to enable geospatial research for exposomics, for anyone who wants to do more of this, and personal monitoring. And I know this is very much Dr. Sunil's expertise and topic, so I will not talk more about this. But I wanted to conclude by thanking you all for your attention, acknowledging my funding sources and my brilliant team. And please do check out our websites and links to learn more about this work. Thank you so much for having me.
Thank you very much, Professor Rima, for a very brilliant talk. So you just exposed through this exposomics the kind of how the climate change, how for example, forest fire is affecting the pregnant woman. So maybe the stillbirths, people will not know what is the reason for that, and such kind of studies is going to be a very eye opener in the medical science also. It can give reasons what exactly has happened in a stillbirth or birth defects and so on. I think you have given a lot of food for thought to our young students, over 67 on board right now, who will certainly think on future research in this area.
Yeah, so thank you very much for that long introduction, and thank you, Rima, for that exciting talk. I learned a lot during that conversation, and I was very impressed by the depth and range of the projects that you did. So you're kind of focusing on so many different aspects that it's very exciting and very informative. So thank you very much once again, Dr. Bala, for that introduction. And I'm going to acknowledge a whole lot of people for this opportunity. So I'll be just talking about the importance of the spatial and the temporal perspective in general. I don't have too many case studies to show, but I'll be focusing on, for the sake of students, what is an area and what's the thrust they can have in terms of doing research on health applications. But I'll be basically coming in from a geospatial perspective, in simple words, from a spatial and temporal perspective. So the assumption, the premise is that most of the patterns that we see in health-related issues and human services related to health issues have a predominantly spatial pattern and also a temporal pattern. And it's very important to understand those patterns to be able to provide any sort of intervention and also early intervention. So I know Dr. Bala introduced me, but my last qualification was from the School of Geometric Engineering at the University of New South Wales. So what we do in geometric engineering is we actually try to master the science of extracting information from different types of satellite data sets. And I had the honor to work under Professor Bruce Crosby Foster, who is one of the doyens of remote sensing. So other than my studies at University of New South Wales, I was also a faculty at the University of New South Wales, and I moved on to the University of Southern Queensland. And I also worked for Federal Government of Australia, Geoscience Australia, where I worked on the MODIS thematic mapping project with JPL, with colleagues from JPL in Pasadena. That's a neighborhood where actually Rima lives. So I'm also the United States Fulbright Specialist for the period of 2025 and 2028. And I've actually worked with MIT Bangalore and also MIT Manipal to prepare the Fulbright Specialist application. And I'm sure Dr. Bala and Dr. Ivan Jose, the director of the MIT at Bangalore, are eagerly waiting on the results of that application. And hopefully once that comes through, I'll get an opportunity to come back to Manipal and also to Bangalore and to fulfill some of the unfinished work. So with that note, I just also want to mention about the BCC Geospatial Center of the CUNY Crest Institute. So the CUNY Crest Institute, there are 5 such institutes in the United States. It's a multi-million-dollar institute. And I had the privilege of building this center from the ground up when I started working on it in 2010. And recently, on the 3rd of October, 2024, we celebrated 10 years. So we have come out with a decadal report. So I'll invite you all to go through these hyperlinks about the center and the decadal report. So I think all these, things about health, issues and all these inconsistencies about the distribution of health and the equity-related issues are probably related to the way we are organized on the Earth's surface. So if you look at the human population, we're close to 8.5 billion people living on probably 20% of the Earth, because most of it is taken up by water and other physical features. So that pretty much sets the tone for the differences that we see in the health issues and the patterns. Because if you crunch a lot of people in a small amount of space, you're obviously going to see a lot of planning-related inconsistencies, planning-related issues, and that somehow translates into the health area as well. So this is just a breakdown of what is the available land and how many people actually occupy the Earth and how much of a struggle is there just to live in a proper environment. So we are also trying to focus and work on social determinants of health. So the premise is that if all the environment around you is healthy and everything is ideal, then the chances of you being unhealthy is very less. So I think health is an outcrop of all those factors in the larger scheme of things. So as all of us know that the human population has actually taken off in recent decades, and there is a big aspect of the importance of human activity and how that impacts health-related issues. So we have all these related problems, and I think health is also one of the outcomes of this arrangement of land and population. This is just like there is a slide which I wanted to show you particularly. This is a simulation. So we use satellite data sets to look at urban sprawls, for example, and we can use different sorts of sensors to study how the particular city evolved over a period of time, and what that means to health indices, what that means to spatial patterns of health issues that we see in the modern time. So I think one of the projects that I did long back, I think 20 years ago, was at the University of New South Wales when I collaborated with the School of Drug and Alcohol Research Center. And they had a huge database which consisted of incidents related to drug overdoses. And they also had data sets on locations of the drug injection centers. So just to give you some idea, when a person suffers from drug overdose, they are typically taken to a drug injection center. So in New South Wales, historically, there are many drug injection centers. So they found that there are millions of drug overdose incidents. And when they tried to spatially analyze the proximities between the drug injection centers and the incidents themselves, they found that most of the times the distance from the case endpoint to the drug injection center was much beyond the required response time. So it's very important for the patient to actually reach the drug injection center within a response time of 5 minutes. So by just using archives, data from the archives, and also looking at the historical locations of the drug injection centers, we can see the disparities of services. We can see that health services are not equitable. And it also helps in manipulating the policies. It also advises policies to be changed so that more and more people can get treatment within the required response time. So to all the students who are listening to this conversation, I would urge all of you to start thinking from the spatial perspective, to look at the patterns of health issues, how they are spread on the earth, and then how much services can be provided, where are they located, and things like that. Another project we did during the recent COVID, especially in New York City, is that we found that the health centers did not have adequate resources to attend to patients who were suffering from respiratory problems. And these inequities, they only surfaced when the problem hit the town. So we did some analysis using confidential data from New York Health Department, and we found that many of these health services should be better prepared in case there's another pandemic in the future. Some other research that we also do is related to urban heat islands. So urban heat islands is a major problem, especially in New York City, which faces shortages from the grid. We don't have enough electricity. So by 2034, we would really have to switch over to clean energy. So there is a certain community which faces a lot of power outages. And during the summers, when you don't have enough cooling facilities, it can lead to health issues, mental problems, and so many other problems. So we use NASA's ASTER dataset to create dashboards where we can actually look at the thermal, the temperatures of the particular region over time in a year, and we can look at those hotspots. And once we have those hotspots, by regular monitoring from satellite data, we can actually then plan for early interventions or even plan for some nature-based solutions. For example, planting more trees, or maybe adding more, shades on bus stops and things like that. Another project, just to give some examples, is a project that we did with the School of Architecture in Milan. We did a comparison of both the cities in Bronx and Milan to see how much of fresh food is available for the elderly population. So we used a lot of network analysis to find out that fresh food actually is not available to a lot of people, because by the time food is farmed, and then it's made up, it is transported to the retailers and finally to the customers. There is a big time lag, and fresh food is not really fresh food anymore. And then the elderly have additional problems. They don't have that much of mobility. So this study, all these papers, all this research was published, and I'm quite happy to share that to the through Dr. Rahul or through Bala. So my understanding is that risk is omnipresent. Health issues may have a spatial pattern. So it's very important to understand that by monitoring, by using different sorts of data sources. And then visualizing these patterns is also very important so that you can provide early interventions, or you can simply allocate resources based on what you see on the data. So understanding the spatial and temporal patterns is probably the only way to improve human health, because personally, I believe that the situation has gone out of hand. Lots of people are living below the poverty line. Many people don't have medical facilities. Many of the poor don't even have insurance. So for them to be sick is mostly like a death warrant. They're just waiting for the time to pass out. So I think a lot of situation has gone out of hand. So the only way to improve the situation is to be able to use data and to use different sorts of resources, like Rima just mentioned, at different multi-scales, to find a way to look at those patterns and then allocate resources in a more justifiable manner. I think that's the way to go in the future. And interventions must always be based on location-based analysis. So when it comes to geospatial technology, there is a suite of systems generating terabytes of spatiotemporal data sets. So we always we have a problem because there aren't enough number of analysts to analyze that data set. So we're always trying to catch up, because every day, every other day, every country is sending heaps of satellites into space. It is good news because we're getting data sets from different sorts of resolutions, but it's bad news because a lot of that data is not really analyzed at the pace at which it should be. So there is a lot of potential to look into these data sets. Rima gave some examples. It's also important to look at the accuracy of the models that we make and to actually test them. Only then that can be used for policies. Most of these data sets, especially NASA's come out with a new data set called the Harmonized Landsat Sentinel-2 data set, which is a fused product where they use two different programs, one from the European Space Agency and one from USGS and USGS program, which is the Landsat. So they have fused these two products, and the advantage is that now we have a global coverage to look at any sort of patterns at a global level. But the data has some issues. So whenever we talk about data, whenever we talk about remote sensing or any other sources of data, it's very important to quarantine the data, and it's very important to understand the accuracy of the models that you've created, because the next step would be to use them in a policy-related decision. And I think it becomes very incremental and very important to look at the data quality and the accuracy in that situation. So very often you see a lot of open data available. And I keep telling my students that open data is good to create some sort of a prototype, but many times they're not curated. We don't even know what's the data lineage. So you cannot really count on those data sets. The only instance when you can actually have control over data sets is when you create them on the field. Or if you acquire the data, you have to have the accurate metadata. And these things are fundamental and very important, because when you go a long way analyzing them, after a few years, you realize that the quality was not as much as it should have been. It becomes a huge problem because you've invested time and it's not ready to be incorporated into a policy. So global positioning systems is also a very useful instrument. And these days you have very high precision. If you use a Trimble Pro XR receiver, it gives you 0.5 centimeters accuracy. And the GPS data sets are particularly important in health-related applications, because you can take the receiver, it's very portable, and you can hook it up to a computer and get all the details for the samples that you've taken. And there are other sources where you can get data for geospatial technologies. So again, when you look around the world, you'll see the problem is the same. You have simply a lot of people living on this earth. And most of the health issues that we face today is because of that overpopulation and the fact that we have very less space to live on. So all these things are interrelated to the overpopulation and also to the fact that many countries are living below the poverty line, many people in those countries. And that creates huge systemic problems in terms of how to address health-related issues. So you have all this environmental degradation that leads to health problems, extreme heat. A lot of countries suffer from extreme heat. They have problems dealing with that. Severe weather, you have extreme weather events because of the anthropogenic activities in the last 4 decades. And that has given rise to so many problems. You have water and food supply shortages, and you have degraded living conditions. A lot of people live in shanty towns. They live in neighborhoods which don't have hygienic, environment. So that also leads to health-related problems. And the reason why I bring all this up here is to not just focus on the issues of health alone, but also to look at the underlying factors, which leads to this sort of a disparity and which leads to this sort of health-related issues. So I think Rima also touched about this in one slide, unless you look at it holistically, unless you have a multidisciplinary approach, you cannot be solving any problems related to health. It's very important to understand that health may be related to inappropriate planning. It may be related to a number of people living in a specific place. It may be related to lack of resources. So if you are trying to address health issues, you can possibly have 2 approaches. One is to look at the problem and to intervene, which could be a short-term remedy. But if you're trying to address it in the long run, it is very important to model all these underlying causes, which leads to health disparities. So the role of geospatial systems, it can be used. Again, I say this with a lot of caution. Just because you have a technology, you have to massage the data properly. You have to do the analysis properly. You have to control the error propagation in your models. Only then you can get a sort of informed decision model that could be possibly used. So geospatial systems can be used to observe phenomena. It can be used to monitor conditions in a specific place, and you can use the data to analyze it and then make your own informed decisions. And that may be highly localized, something which Rima alluded to in her talk. So I think we are at a point of no return. There is no universal remedy to health issues unless and until we address all the underlying factors. So it's very useful to look at the problem as it emanates, but I think it's very important also to look at the reasons which leads to that problem. I think that's the way to go in the long run, and that requires serious collaboration. That requires serious understanding of all the different components that lead to those disparities. And I think we can salvage the situation by well-coordinated efforts. Geospatial systems are critical. Coordinated global efforts are needed on a war footing. And I think health issues are more of an economic problem that needs to be addressed first. So even before we address all these health-related issues, it's important to look at food, shelter, medicine. The basics have to be provided. If you're not going to provide the basics, health issues must happen. There will be problems related to health. So unless those aspects are addressed, I think we will just be doing a lot of short-term fixes. So understanding and modeling the spatial and temporal components of health issues is probably the way to go, so that you can pinpoint a problem to a certain location, and then you can try to understand what leads to that problem, look at the underlying factors, and then fix the problem itself. And I say this because we don't have solutions for every problem that you see on the earth. So you have to approach it using science and community-based approaches. So the key takeaways, I believe, are from my talk that locational awareness is critical. multidisciplinary approach is critical for holistic impacts. And then the health facilities during the COVID, superior holistic planning is important. Health services, redistribution of services is important. Patient profiling is important. Early interventions and coordination of mitigation efforts. And then there is the promise of geospatial AI. So we're doing a lot of artificial intelligence. We are creating models using deep learning. And the deep learning, the geospatial AI itself is going through a domain-related problem because a lot of people from the computer science department, they are coming in with big data centers and they think they can use the chat GPT or the LLM model to create these artificial intelligence models. But they have to understand the inherent nature of geospatial data. They have to understand the spectral and the spatial characteristics of remote sensing data. They have to understand the spatial heterogeneity and the spatial generalization issues before you can actually put together an AI model. So that itself is going through a lot of paradigm shifts. And in the next few years, we might hopefully see a better understanding of what is a geospatial AI. And I mentioned geospatial AI with a lot of care. It has potential, but it's mainly driven, as you can all imagine, by accurate training data sets. If you don't have enough training data sets, you cannot create a geospatial AI model. So I think there is promise. Just to summarize my talk, it's very important to understand health issues from the spatial and temporal perspective. It's also important to understand the underlying factors that lead to all these health disparities and not just focus on the problem itself. So there are two things to focus on. One is to look at health-related aspects in the short run, and one in the long term. And I think looking at the long term is critical to create a very, a very consistent and a very healthy world. So with that, I think I am probably a little earlier than necessary in my talk, but I think that would be enough from me. So thank you so much.
Thank you very much, Sunil. You're well on time. So you kind of, in a very simple words, in a very easy to understand language, you have told enormous possibilities of geospatial AI, which can kind of change our life itself. So name anything, you have the solution in geospatial AI. That's what you expose to our young students. I'm sure many of them will take up such kind of research using geospatial AI as a tool and better understand the problems and provide easy solutions. As you said, there's a lot of data available from the satellite, which is not yet interpreted. So I think there is a need to interpret this data well and understand the problems better to solve and help the mankind. So thank you very much, Sunil, for this very enlightening talk. Much appreciated. Now we go over to some few questions. 1, 2, 3, 4 questions. Already there is one question in the chat box for Dr. Rima. I think I'll read out that question, Dr. Rima. She is Shipra Thakur. She says that I would like to know how can exposure models be improved to better capture individual level exposure during wildfire events. That is the question.
Yes. Thank you so much, Shipra. That's a great question. And let me just say thank you to Dr. Sunil for that excellent talk. I have so many thoughts for you that I'd love to engage with you afterwards, but you said so many brilliant things that I hope the students in the audience are really listening closely. To answer the question, so when we model the environment, right, a lot of these models that I showed you and that Dr. Sunil showed you, they're modeling what's happening outside in the environment. Most of the time in epidemiological studies, we are assuming that people get exposed at the point where they live. Why do we do that? We know that is not a perfect assumption because people move around a lot. They go to their work, they go to their friend's place, they run errands. So most definitely they are not only exposed at where they live, but we need that information about the person and their location to link to the model that tells us something about the environment, right? So if we want to get to better exposure models that are more individualized, we need several things. We need that excellent model of the environment. And Dr. Sunil talked about how important it is to validate and test those models, right? So that model has to be excellent to begin with. You need information on the person and their life. Where do they spend their time? How long do they spend time in different places? But also, if you're talking about things, let's say, that are air pollution related, you have to think about how that outdoor air pollution gets into the indoor environment and becomes an exposure for that person. Meaning you need information and data on a person's time activity patterns, their mobility patterns, the characteristics of the place or home they live in, where they spend their time, etc. And you can integrate those two kind of inputs together to build a more individualized model. And there are actually several models that the EPA develops for these kinds of more individualized exposure models. Fundamentally, with any model you build, again, like Dr. Sunil said, ideally you want very high quality training data. In this case, it would be personal measurements. So you can test your model and see how well it can recreate or predict those individual level exposures. Another brilliant thing Dr. Sunil said is you cannot fix all the problems in the world. So, it's never in research, at least, or in resource restricted environments that we live in, you always have to sacrifice one thing for the other. So it really depends on the question you're asking, the problem you're trying to address, where you sacrifice, whether it's getting more to the individual level or getting a higher spatial resolution, getting more chemical specificity, etc., etc. I hope that answers the question.
Yes. Thank you, Rima. There's one more question from Dr. Suhana S. Rai. She says that what practical steps can healthcare providers take to or initiate to protect pregnant women during heat waves or high pollution days, or maybe I will add forest fires and so on?
Okay, Dr. Suhana, thank you again. That's a great question. I think the really important role of healthcare providers, and again, Dr. Sunil talked about this too, is that you are that point of personal contact with your patient, right? I'm assuming that means a medical doctor, not necessarily just the institution, or a nurse or a health practitioner. So you are that trusted source of information and advice as you're taking care of your patient, especially pregnant women. I think we have to realize that most of us, again, as Dr. Sunil explained, are living in a very tough world. There are poverty issues, there are resource limitations. We all have day-to-day responsibilities. So people will not always appreciate or have the luxury of worrying about things in the environment if they have more pressing concerns in their day-to-day life. If they need to make a living, get their kids to school, etc. So what this tells me is, in your role as a healthcare provider, you can be that trusted source of personal education and awareness for your patients to actually make sure they know that high heat waves are very dangerous for them and for the baby. And high pollution days do have an effect, and they need to be kind of careful to take protections. I am not advocating for causing panic to a pregnant woman when she has many other responsibilities and concerns in her life, but I do think there's a huge gap in sort of appreciating and understanding the dangers of these environmental exposures, specifically in vulnerable populations, because of these chronic stressors and issues that we keep talking about. There's tons of resources out there on cooling, on air filtration, if possible, but also being aware that theoretical solutions don't always translate to real life. If someone has no power or electricity, most times of the day or cannot leave their job, you cannot be recommending something that's unattainable, right? Wondering if Dr. Sunil has anything to add to that, or hopefully that.
No, I think you've said it all. I think whenever we use technology and whenever we try to find a solution, it has so many different components to it. It has the data component. It has, like you rightly said, how are people going to perceive the solution? How are they going to accept it? So from an implementation perspective, there are so many social, economic, political, overtones. So you have to model all of that to be able to implement something that can really work both in the short term and in the long term. And I personally feel that all these inconsistencies that we see is primarily an offshoot of the excessive population and the mismatch of the resources that they have to lead a proper life. And I think that's why we end up in all these scenarios where we're doing research on health, we're doing research on urban planning, we're doing research on housing, we're doing research on heat island. So I think it's just the way we are organized in today's world that we face all these problems. So like you rightly said, you can have a quick fix approach, in which case also you have to look at the social dimensions, the mental aspect of it. And there is so much to model, irrespective of the scale at which you're looking at. And obviously, it's better to look at all those things at a small scale so that your error propagation to the next level is limited. So I think your case studies were brilliant because that gives a window of opportunity for all the audience here to see what's possible. And then the discussions we've had should be an eye-opener to anyone who wants to do research in the health area, that these are the challenges that they have to address in case they want to emerge as a top-notch researcher. So, it was brilliant what she said, yeah.
Yeah, Sunil, just in continuation of Dr. Rima's talk, she said that wildfires is exposing the health of the pregnant woman. So whether wildfires are there and the women who are pregnant cannot leave their hometowns, they have to be there near. So whether geospatial technologies can help in any way map those areas and then maybe extra medical care can be taken, they can't avoid. Is there any way this exposure to these can be prevented on these vulnerable women or population?
I think technology, we have to understand before we use technology that technology cannot do everything for us. It's just a tool to support the core science. So a lot of people have this misperception. They think that when you're starting to work with satellite data is going to solve all the problems in the world. But what we need to understand is that there are different components to a problem. And one of them is to build awareness or to precisely tell where the problem is. So when you use satellite data, it's just a location-based analysis to tell you where the problem is and how the problem might have emanated over a period of time. But in terms of addressing the problem itself, in the case of pregnant women, like Rima mentioned, it's very important to build up the awareness levels. The best way to address health issues is to have self-awareness. You cannot really look for anything external to address those problems for you. It's like having a policeman or a policewoman for every person in the world. You are never going to get that scenario. So it's very important. It's a combination of self-awareness. It's like you would imagine pregnant women to also be educated. Hopefully, they when they are educated, they've gone to a university. It's common sense to not be close to a wildfire related scenario. But then they don't have that economic choice to move away from that place. So there is a lot of these issues that is kind of like Rima mentioned, intertwined. And unless you understand those little aspects related to the social aspect of it, the political aspect of it, and the most important economic aspect of it. Today, we see a lot of people in New Orleans face a lot of storm surge, and they're devastated. And so a lot of my students ask me, so Professor, why do they live there? Then I asked them back. I said, do you have a better choice for them? Do you have another house for them that they can go to? So some of those choices may sound very simplistic, but they're actually very complex. So I think any student who wants to do a lot of research on health-related sciences, it's very important to know that technology has limitations. Technologies cannot address your emotional problems, your social problems, your political problems. They only come at a stage where you can use data to map out and to create some sort of awareness in terms of observing a phenomena, or to be precise with your resource allocation, or to be precise with your planning processes. So that perception has to go away. A lot of students, including some of mine, they think that by looking at a mobile phone or by looking at some smart devices, they can solve all the problems in the world. But thanks to core sciences, thanks to all the natural sciences and the things that you do, Dr. Bala, I think we still have to be grounded and understand that there are problems which are much more humongous and complex in nature than simply using a device and solving them.
Suppose one or two major countries choose not to participate in this very essential global movement, which is a matter of survival for almost all mankind. How would it affect the work of the rest of the people? Because if there is a fluctuation in funds or contribution of some weightage to your efforts, so do you have any plan B or something like that? Or would you say, let nature take its course? Or personal curiosity.
So, Rima, is it okay if I go?
Please, please.
Yeah. So I think that's a fantastic point that you mentioned, and I think again that is an offshoot of the economic situation that we have today. So if you look at a country like Japan, they produce high quality goods. So when they produce high quality goods, their goods can compete with any country in the world. So I think the answer to that question is self-reliance and to produce goods of the highest quality, be it education, be it medical. And the reason why United States is in the forefront is it's because it's able to galvanize diverse talent from different parts of the world. But most importantly, we have a structure here which enables people to work to a plan, and there are less obstacles. So I think countries like India, which consist of a young, super intelligent and super talented people, if you get the processes right, if you are able to create those milestones and those benchmarks, then universities, for example, can produce great talent that can compete with anyone in the world. And if you do that for a long period of time, you are building a self-sustainable model. And you don't have to go to plan B then, because you are the plan A. When you produce excellent products, you can compete with anyone in the world. And I think the disparity that you see is obviously historical. We've been colonized for a long time, and all the wealth has been taken out. But I think more than that, the work culture, the fact that we can synchronize and get all our goals together. Like I was talking to a pro-vice chancellor, again, I won't name the university for political reasons, and he was telling me that the federal government has come up with a new protocol that all faculty members must publish close to 15 or 20 papers a year. I personally take about a year to publish one paper. So what that means is you're compromising on the quality. So after a few years, when you look at the landscape in India, you see that a lot of below average products are released. So that will never, so in a way, you are distancing yourself from the best. So the key is to excel in what you do. And that's exactly what America is able to do with all the people from different countries. They are not just able to immerse them, they're also able to provide them with a very professional environment. You've been here, so I don't need to say that to you. You've seen it all. And you're in a very good position because you're back home and you're trying to do all these things. So I think the key is to reduce the economic disparity by excelling in whatever you're doing. And suddenly you'll see that the shift is slowly changing. Otherwise, we will be embarrassed by scenarios where you are looking at a big brother to support you forever. And when the big brother is unhappy, you are like an orphan in the wild. So I think those are my 2 cents, Professor. I hope I have touched some aspect of your question.
Well, you have been very careful to avoid the political scene. I respect it. But AI is not going to help. It's going to, among the papers you mentioned, there has been a sudden spurt of contributions of papers. So even the digital publishers have to be very, very careful, but maybe this is not the forum. Thank you, Dr. Bhaskaran, for responding in a certain... Yes, Rina, Miss...
If I may, I just want to add a couple of thoughts. Because Dr. Sunil, really answered perfectly, and I do understand your question, Professor Krishna. I really do firmly believe that if you excel in the work, that's what keeps it going. Obviously, my center is NIH funded right now. We've had many uncertainties and stressful situations, but we are still here and the work continues. And it's always my priority to do the best work possible, because I honestly do not believe anything else. There are big drivers, there are small drivers. The world is facing many, many problems beyond my own research, right? So there's nothing else I could do or do for my team than try to do the best work we can do. But I also am saying this because Dr. Sunil made such an important point earlier that I would really love to just re-emphasize for all the young students in the audience. These days, I see this a lot as well with all the students I interact with and all the kind of up-and-coming generations. You have brilliant computer scientists and let's say people with technical expertise. We're not just picking on computer scientists, right? And they have amazing technical tools that they want to apply to a problem that is humanly relevant or has some societal relevance. But what I see happening most of the time is they do not engage with or try to even engage with the domain experts and the people who have the knowledge about that problem to try to together work on solving it. I think that's a problem because, again, our incentive systems are driven by how many papers do you put out there and this competition to sound like we're experts in every single thing. And I think that is incredibly dangerous. And it's also leading a whole kind of set of kind of new groups of talented individuals into a very kind of, in my personal opinion, less impactful or useful space, right? So I do think I face this all the time because a lot of my talks that I give are trying to explain these concepts to people who want to work on them. Most of the time we find that people are taking big data sets, AI models, whatever they are, running some really cool, sophisticated machine learning model because they have the technical skill. But if you present that to anyone who knows the problem, they will know in 2 seconds that that makes absolutely no sense. So I'm just saying this to encourage everyone in the audience. They definitely need to understand and sharpen spatial skills, as Dr. Sunil said. B, you cannot just be a technical expert. If you want to work on these problems, you have to actually engage and work with and listen to and learn from the domain knowledge experts to do that high quality work. Yes, that's more than what you asked, Professor Krishna, but I needed to make that comment. Thank you.
Thank you very much. Thank you.
Thank you so much. It was, I think, I mean, there couldn't have been a better question, a better response, and a better group to answer this question. Thank you so much for making it so wonderful. Over to Balakrishna, sir. Over to you, sir.
Thank you for almost, it went to 1 hour and 30 minutes. We are expecting to be finishing in 1 hour, but interesting questions from all of us, including Professor Krishna, gave. So it helped us think more and, to solve the problems of the world and the health. So it was very interesting talks, Rima ji, Dr. Rima. So thank you so much for accepting our invitation and then delivering an interesting talk. I thank Dr. Sunil Bhaskaran, who again created all our curiosities to spread up. So thank you very much for that interesting talk, Sunil, and for accepting our invitation also. Much appreciated. I thank all the student members who have joined and then also heard the lecture, and also a couple of them asked the questions also. So thank you very much. I thank Professor Krishna for giving the entire session with a good weight, with good experts like you also joining in. Thank you very much, sir, for joining in to this talk, and also all our team members led by Professor Rahul and our faculty colleagues, Dr. Vani, I can see, and Alisa, and another. So faculty, I cannot recognize her. Thank you very much, madam, for all of you for attending this talk and making it very lively and knowledgeable. I also thank Prasanna School of Public Health, the director, for giving me an opportunity to be the moderator of this session. It was a great learning for me also from all of you. Thank you very much. So final word again from Rahul for concluding.
Thank you. And we sure will keep you updated, posted on our upcoming lecture series. And the purpose of organizing such is to bring everyone together, to keep us updated, to keep us connected, build networks, and always stay in touch towards a better, greener, cleaner world. Thank you all. Thank you. Have a great day.
Thanks so much, everyone.
Thank you.
Thank you. Bye.